Alright, I'm going to be doing an IV push through a saline lock. Again, I have verified my order, checked my medication with the MAR, and I have my medication labeled. As I come into the patient room, I have a saline flush along with me. I'm going to come in, check my patient's armband, perform my rites, and get my saline open. A lot of times these are kind of stiff when you first open them, so I'll give them a little push before I open the tip of it. And then another precaution that you might take would be to pull down before you push up to purge the air. Alright, I'm going to, scrub my injection port. I never want to access a port unless I have thoroughly scrubbed. Do a vigorous little scrub. Screw this on. Unlock my saline lock, because it should always be left in the locked position when it's not in use to prevent blood flow from backing up into there. And I will slowly push 3 milliliters of saline. I don't need to lock it off in between because I'm going to directly access that again in a minute. I'm going to replace my cap, and when I laid my cap down, I laid it with the tip up so I wouldn't contaminate it. And then I just picked up some type of a tip to put on this, but I'll take it off completely. I wanted to maintain sterility of it. I might re-cleanse if this has been out of my line of sight, if the patient might have moved or coughed on it, or anything might have happened to have contaminated it. And then I'm ready to push my medication. Now the rate that I push will be dependent upon the amount that I have. If you have a 3 milliliter syringe, then you will have 10 lines per milliliter. Again, you need to know, like if you have a 5 milliliter syringe, a 10 milliliter syringe, how many lines per second, or lines per milliliter. And say that I've looked up my drug before I come in the room. I know that it needs to be given over 3 minutes of time. I want to convert my 3 minutes to seconds, so that's 60 times 3, it's 180. And then I have 2 milliliters of fluid, and I know that it has to, it is in 3 milliliter syringe, so that's going to be 20 lines, so 10 lines per milliliter. And then if I simply divide 18 by 2, I know that I'll get 9 seconds, and I'm going to give 1 line every 9 seconds. This is something that you're going to be responsible for, knowing how to figure up your lines per second. Okay, so I'm going to be watching my watch, and turn that around there some, and then I'm simply going to push 1 line, and then I can, rather than doing it 1 line every 9 seconds, I'll do it 1 line every 10 seconds because it's easier to watch on my watch. Wait that amount of time, 10 seconds, and then I'm going to push another line. Every 10 seconds I push a line. I don't have it screwed in there good. Okay, so I'm going to completely push all the medication. This is trash. Take that away and reconnect. And then when I begin to push, I'm going to push at the same rate that I was pushing before. And actually, I'm going to need to refigure, because my saline 10 milliliter syringe doesn't have the same amount of lines per milliliter as my 2 my 3 milliliter syringe. So I have to refigure that. I'm going to then again, once I've done my math, do a short push, wait the allotted amount of seconds, do a short push, wait the allotted amount of seconds, and until I have pushed 1 milliliter of saline. After I've pushed a milliliter of saline, I know at that point that I've cleared out my loop with medication, and I just have saline left in there. I can go ahead and push my other 2 milliliters of saline just at a usual slow rate. As I'm pushing, then I want to lock off, be pushing a little bit, lock off before I disconnect. Always make sure that you lock and then disconnect, because if you pull this out, it allows a little bit of suction, which will pull back a small amount of blood into the end of your vena cath, which then of course would clot and cause you difficulty to access it the next time. Now, that is pushing through a saline lock. If you need to push medication through a continuous line, and here I have a continuous line running, I always want to go to the lowest port, closest to the patient, and I'm saying that this is running into a patient, which I know it actually isn't. I want to cleanse the port, do that good vigorous scrub, and then once I have done that, then I can access, screw this on, and then again I'll push that one line every 10 seconds, one line every 10 seconds, saying that this is the same medication. So one line every 10 seconds. Now, every time I push a line, the pump is running, so it continues to infuse it. So as soon as I push that line, it goes on into the patient. It's not collecting here in the pump, in the line. So I push a line, wait 10 seconds, push a line, and wait 10 seconds. Now, this is in the case that I have determined that the medication is compatible with my primary line. Then, if it's compatible, I only have to walk up here, cleanse my port, access it, and push one line the allotted amount of seconds. Push one line. Now, in the case that it is not compatible with my primary, then I'll have to treat it just like I did with the saline lock. So I'm going to turn my pump off. I am going to pinch off above the line, cleanse my port, flush with saline. I'm going to push in 3 milliliters of saline at a normal slow rate. Then I'm going to come and I'm going to push one line every however many seconds it's supposed to be pushed. And then I'm going to come back, and I again have done another math problem to figure out how fast I need to push this first milliliter. And I'm going to again push one line, wait the allotted seconds, push one line, wait the allotted seconds. I may, because I've got a fairly long length here, do that for 1 to 2 milliliters. And then once I've hit that 1.5 to 2 milliliters of fluids that I've already pushed in, then the last milliliter I can push in a little more rapidly. Once I'm finished, I turn the pump back on, and I'm done. And that is the case where you have an incompatible medication, and then you treat that pretty much the same as you do a saline lock.